So let's talk about phenotypes and endotypes of sleep apnea. Phenotypes would be kind of expression of sleep apnea, which could look like snoring or daytime sleepiness or not waking up refreshed or insomnia. So think of that kind of like the symptoms that you may have or be experiencing. An endotype is looking at the pathogenesis or like the mechanism of action as to the cause of your sleep apnea. There are different endotypes, and I see this when we do an evaluation that's focused on a more personalized approach where we're looking at clues from the sleep study and imaging, and we're looking at your history as well to see if we can kind of look at the underlying cause of the sleep apnea. Some of those endotypes, meaning the causes, could be collapsibility. That could be from too much weight or underdevelopment of the bones, or too much soft tissue that's kind of floppy, or the tongue being in the wrong position. And so it's easy for the airway to collapse at night when we sleep. Other endotypes could be an arousal threshold with the brain waking up too soon. And so sometimes what can happen is we can have the brain waking up too soon or waking up easily, which then can cause the brain to say, pause in breathing. And that actually is not an obstructive reason, but it's so just the brain is waking up easy and causing this pause in breathing because of light sleeping. Okay. Another endotype could be looking at tone, airway tone, and oftentimes alcohol can contribute to a lower tone, or even as we age, we can see a lower tone in that muscle. And so providing some resilience to muscle and soft tissue can help there. Metabolic health, inflammation, cortisol, these are all factors that can contribute to the airway being less resilient. And also we can have multiple reasons or multiple phenotypes and endotypes at play when we're treating. And this is why we take a personalized approach to treatment for your sleep apnea and sleep.